Good morning, ladies and gentlemen. Welcome to the SIA, ACES, IES, SISV, BCA Restart Clinic on Good Practices on Project Restart Application. My name is Colin from BCA, and I'll be the host for the webinar session. We are happy to have the Singapore Institute of Architects, SIA, the Association of Consulting Engineers Singapore, ACES, the Institution of Engineers Singapore, IES, and the Singapore Institute of Surveyors and Valuers, SISV, in joining us today to organize this webinar clinic. We hope that this clinic provides good understanding on Project Restart application, the self-help tool, the do's and don'ts when filling up the application so as to facilitate quicker approval. Before we start, please note that as participants, you are on mute setting. Should you have any questions about the discussion topics, you may do so by clicking the Q&A button on your screen to type in your queries. When we get to the Q&A session at the end of this webinar, we will also be activating the raise hand function to take live questions from the audience. Should you wish to ask a question verbally at a time, do click the raise hand icon. Do also note that when the session ends, you will be directed to access an evaluation form after you have exited the webinar. Once submitted, you will be able to download the speaker's presentation materials. We are pleased to have Architect Leong Kok Su Ming, MD, BCA Academy, Architect Richard Lai, Second Vice President of SIA, Engineer Chua Tong Seng, President of ACES, Engineer Chan Eugene, Vice President of IES, and Mr. Colin Kin, Second Vice President of SISV, to co-chair the session. Together with them, we have from BCA, Mr. Jeremy Tan, Deputy Director, Building Plan and Advertisement Licensing Department, Ms. Vivian Fu, Deputy Director, Strategic Engineering Projects Department, Mr. Ted Chan, Executive Manager, Procurement Policies Department, and Mr. Abner Wee, Executive Manager, Green Building Policy Department, who will be addressing the queries during the discussion before the end of the seminar. Without further ado, let us invite our webinar co-chairperson to deliver her welcome remarks. Architect Su Ming, please.
Good morning. Is it good? Can you hear me?
Yes.
Okay. So good morning, partners, ladies and gentlemen, especially the co-chairs from SIA, ACES, SISV, and IES. Thank you for co-hosting this webinar today with us. I'm really pleased to welcome everyone on this joint restart clinic on good practices for restart applications. Over the last couple of months, we've had multiple conversations with multiple members of the sector, and this has indeed been engaging and fruitful with very constructive feedback received on restarting safely, as well as in shaping the longer-term strategies for our industry. We've been holding these webinar clinics since the early part of this month to provide support on project restart applications and the use of the self-help check tool to facilitate greater confidence to restart quickly but safely. So far, over 4,000 individuals from about 2,000 firms have attended these clinics, and there's another, I can see, about 1,500 attendees in the session today. With all these clinics and our close collaboration with industry, today, we've approved more than 2,500 construction projects to restart, and this is really a 20-fold increase from a month ago. Nonetheless, for those projects that are still preparing to restart, BCA is very happy to work with you to ensure that you are able to do so safely. It is really all our interest to ensure that workers are COVID cleared and there are SMMs or safe management measures that are in place on site so that projects can get along going quickly. At the same time, for projects that have restarted, we will need to ensure that it remains vigilant in implementing COVID-safe measures to prevent a resurgence of the virus on site. Achieving a COVID-safe sector is really the responsibility of everyone along the value chain, including everyone present here today. The use of technology can also be deployed to ensure better COVID-safe control measures on site. This includes remote monitoring as well as data-assisted alerts in compliance checks. So firms can today consider adopting the BCA-led BuildSG COVID Safe platform, which is a digital solution that can enable more effective COVID safe management measures on site. Please work with your project teams to consider this. In addition, to further support the construction firms and construction projects for a safe restart, a 1.36 billion construction support package was also recently announced to assist the sector. So with today's webinar, we hope to continue to deepen our conversation, to take in feedback from the consultant community, and to help clarify questions that you have so that we can all look at strengthening practices for a safe restart in our sector as we adapt to the new normal. Thank you very much.
Thank you, MD. Next, we will have BCA to share with us on the group practices on project restart applications. Engineer Charmaine and Mr. Jeremy, please.
Good afternoon, I'm Charmaine. I'll take you through this presentation on Guide on Project Restart Application. A quick overview on today's presentation, which covers the application process, results of application, swabbing for consultant, support measures, and in-house audit and inspection after the project restart. This is the overview of the restart application. BCA is the one-stop shop front overseeing the construction sector restart. For today's presentation, I'll focus on the construction projects, supply works, and landed properties. For these projects, the builder may access the self-check tool to check his project readiness for restart. The project or supply work will need to meet the safe worksite, safe Accommodation and Transport, and safe workforce criteria. We have earlier uploaded these infographics with application links to guide the restart application process. I would like to highlight for the projects which have obtained TOP and into DLP phase, the restart application will come under construction account works. The first step of restart application will be for the builders to fill up the self-assessment checklist. Details should be filled as accurately as possible. Once submitted with all three safe restart criteria met, a link will be sent formally to submit the application to restart. For any assistance, you may contact us at BCA Construction Restart at bca.gov.sg. This is a screenshot of how the forms look like in the Form SG for the Safe Worker Accommodation and Transport. For the safe workforce, all workers to download Trace Together and SG WorkPass to facilitate contact tracing and track the health status of the workers. For the safe work site, there's a requirement on the provision of SMO and SDO. One SDO for every 50 workers. When there is more than one activity carried out on site, segregation will be required. For the application, there will be a total of 6 documents to be submitted. I will go through briefly in the next few slides. The first is the Form SG main submission form. This shows the screenshot of how the form looks like. The project value should be selected accordingly, more or less than $3 million, and NA if it's for supply works. The project value will be referenced to the project cost in the permit application. Okay, the first form, construction and supply Excel form, where the project details are required. Some of the common mistakes are made in the form filling process, such as the input of the project reference number wrongly, or split into multiple cells, or with the wrong date format. Under the firm and employee details, all personnel, including part-time staff who need to access the site regularly, will need to be included. The second form is on safe restart declaration. In the self-declaration form, please do not leave blanks. Either yes, no, or not applicable should be filled. Submission may be auto-rejected if they are not in order. These are some of the common non-compliance items observed, such as utilizing safe entry NRIC at all entrance exit and provide individual packed meals. These are items that are mandatory and legislated. Hence, a declaration of no will not be accepted. On the provision of sick day, there can be some exceptions, except on a case-by-case basis. For example, small sites, landed properties, or if the site happens to be located next to a clinic. The third form is the Worksite Safety Submission form. In the Worksite Safety Excel sheet, builder will need to list the activities with the subcategorization, start and end date, and the estimation of number of workers in each phase for a period of 3 months. This is an example of a small landed project which complied with the safe worksite requirements. This shows a 3-month work schedule proposed by the builder. The works are planned in such a way that there's only one activity at any one time. Next will be the safe entry setup. The builder will have to input the branch code in this form. The safe entry NRIC will also provide information on the access code, either green, gray, or gray with a corresponding action. Green to allow entry, red to deny entry. Also, the SMO and SDO appointment to be filled in accordingly based on the number of workers that has been filled in the earlier slides. In the Excel spreadsheet, builder is also to list the workers in their segregated team and their assigned team color coding. The fourth document is the Worksite Safety Plan. In the Worksite Safety Plan, there are 4 criteria to be included: zoning and demarcation, movement control plan, hand wash and disinfecting points plan, evacuation plan for suspected case, and follow-up plan for confirmed case. We'll go through in detail. For the first one, zoning and demarcation, to include activity description, number of workers in each team, and its associated color identifiers, and a team assigned for each one. Zoning must be clearly delineated by colors and specific teams designated in each zone. And there must be clear distancing between the zones. The different teams of workers should be assigned with visual identifiers, such as a colored vest or colored tapes on the helmet. Movement control plan to show access routes for different teams and staggering use of the communal facilities. This is a good example of an infra project where zone and access are clearly demarcated. Location of a hand wash and sanitation provision points. An evacuation plan for suspected case to be included. And also a follow-up plan for the confirmed cases. The fifth document, confirmation email that employers have updated records with MOM. You can visit the MOM online Foreign Workers Address Service to update the address and contact number of the workers. And once updated, an email confirmation will be received. Lastly, a joint declaration by the builder and the developer. Just to note, the application has a 1 MB attachment upload limit. So for large files, you may upload under the additional supporting document link. Once the application has been approved, you may book the COVID-19 swab test for SCPR via the link, and subsequently update BCA on a 3-monthly schedule for the work for the project via this BCA additional supporting document link, and also notify BCA if you're aware of any person on the site who is diagnosed with COVID-19 via the Form SG link as well. Once the application has been approved, amendments may be made to the submission for changes to manpower deployment or places of accommodation. So you can select modification for previously approved application under the BCA construction supply link. When application has been rejected, please review the application and take note of the reasons for rejection and utilize the self-assessment checklist again to assess whether your 3 safe restart criteria has been met. This is a summary of links for the submission of documents for the restart application. Next, for swabbing requirements for consultant. Yes, consultant visiting active construction sites will need to be swabbed. Swab test is not tagged to the number of sites visited. Consultants will need to undergo periodic swab tests. Application to restart for TOP or CSE process. For construction projects which have not attained TOP, developer and builder shall apply for approval to resume construction projects before deploy any construction account, permit, and S-Pass holders to work. For buildings completed, QP may schedule for TOP inspection with BCA via the online TOP or CSE portal. Application for resumption of works to carry out defect during DLP may be applied via construction account works if developer and main contractor wish to deploy construction account, permit, and S-Pass holder. For CSE inspection by other technical agency, if work does not deploy any construction account, permit holder, or S-Pass holder, they may carry out inspection. But if works deploy construction account work, permit holder, or S-Pass holder, developer and main contractor will apply for a resumption of works. What should consultants take note when administering contracts in the context of support measures for construction project or contractors? Firstly, costs of swabbing will be funded by government until 31st March 2021, including RTOs and REs. Provision on ACEA-GRACIA basis, advance payment up to the point where projects obtain approval to resume works, or 31st December 2020, whichever is earlier. Thirdly, co-sharing on ACEA-GRACIA basis, 50% of prolongation costs for contractors. Recognizing that consultants will incur additional costs as well, hence support is provided through enhanced job support scheme. You may refer to the link below for more information. What should consultants take note when administering contracts in the context of relief measures under COVID-19 Temporary Measures Act? 3 criteria. It must be a construction and supply contracts. Enter into contract before 25th March 2020. Unable to perform obligations, example, meet delivery deadline, on or after 1st February 2020 due to COVID-19. The Act does not apply if your case has any of the following factors: inability to perform obligations for reasons unrelated to COVID-19, unfulfilled obligations before 1st February 2020. What should consultants take note when administering contracts? Be aware of the relief measures applies to the employer or contractor. Contractor's inability to supply goods or materials due to COVID-19 is a defense to claim for a breach of contract, damages, or liquidated damages. Employer cannot call on any performance bond granted pursuant to the contract. The other party cannot start or continue court or insolvency proceedings against the defaulting party. Okay, I'll hand this part over to Jeremy. Jeremy, please.
Thank you. Okay, probably I'll continue from here. I think basically what Charmaine has actually gone through with you is actually a series of measures that you need to do actually to obtain approval. So at this stage, what BCA would do is to conduct audit and inspection work on your site. So I'll be basically sharing with you what needs to be done onto the site as a builder or as the owner to these project sites. So at this stage, there are 2 points which I would like to highlight. The first point being the importance of safe management measures. This is basically the only protection against COVID cases and to contain any spread quickly when it happens. Essentially, it is a form of planning that the builder must do after the approval has been obtained, and to make sure that the proper surveillance is being done, a proper maintenance at site is being done, which comprises a series of planning such as the segregation and zoning plans at site, how the workers would be segregated and zoned while they work, the cohorting plans, basically the accommodation that the workers will be staying, and in the event there are actually suspected cases or some COVID plus cases, what are the evacuation plans that you need to have and the follow-up plans. And of course, depending on the sites, you may also have your own penalty systems for any breaches of the measures. For instance, we talk about wanting the workers to wear masks, but in the event if the workers don't wear masks on site, you may want to have some very simple penalty system to make sure that the workers actually comply with these measures. And of course, lastly, the monitoring plan for all these things to ensure the non-compliances and the issues raised on sites are resolved. So essentially what it means is that these SMM measures is a series of plans that you would have on site to ensure that the measures are continuously being implemented. Now, The next part, the second point, is that who shall be responsible in maintaining all this. So at site, we would actually look at the safe management officer, the SMO. The SMO is literally the representative of the site, okay, who would ensure that all these measures under this SMM planning are actually being implemented. So of course, all these things, when it is being approved, there would be planning on site, and the SMO would actually play this crucial role to ensure all these respective measures are being done accordingly. Now, what are the three things to look out for? Okay, there are actually three items here. The first being safe access, which basically is the entry control. Essentially, this would mean that there is a white list that must be which is essentially to control the who are the workers who actually enter into your site. So this is a white list which will be approved by BCA, and accordingly, during our BCA inspections, we will check for it. But I think for the builders or the reps of the builders, these are the things that you need to look for. So the reason why is actually being done is to ensure that only approved personnel are actually allowed to enter the site. Okay, the next part, which is a safe distancing, this essentially is a series of segregation measures that you need to have, which is not unlike what we do in the community, but these are the measures that is to be implemented inside the site. And one thing I'd like to highlight here is actually the importance of pre-packed meals. We would want the workers not to share food. By doing that, they are required to actually have pre-packed meals. And this is important because I think based on one of the reports by MOH, one of the most common reasons why the COVID plus virus spread is through to sharing of food. That is why this is something that we like to actually emphasize to make sure that this is actually being done. So the next part, if everything fails, there must be a response plan to contain the situation. So basically, as I mentioned just now, there would be evacuation plan, or there must be a series of plans to make sure that this is actually being done to segregate the worker, isolate the worker, and to follow up to clean and disinfect the site. Of course, you have to inform the authorities of this. Now, I actually have a series of findings I have. This is actually from last month. We will actually have more findings as of today. These are the actually top non-compliances that we observe from sites when BCA actually audits the large and the small sites. So the top 5, as you can see, first we do actually notice that there is quite a number of mismatch in the entry records with approved lists, which means essentially a lot of workers, when we actually check the white list, they are actually not approved. I think one of the reasons is because when the builder submits or resubmits the additional workers to BCA, they actually should submit the entire list. But I think what some builders did was that they just submit the additional names or the IC of the workers. So it is in that case, what has been actually not previously submitted was not included. That's the reason why there is actually a mismatch in the entry records. The second part is that there is missing safe management measures on site. Now, these safe management measures are actually being updated accordingly as the site progresses. So I think the SMO is required to actually keep the latest copy of the SMM measures to ensure that this is actually being adhered to on site by the other site personnel. The third part is that the Safe Entry NRIC is actually found not installed and used. I think this is actually quite common that we find that a lot of sites are actually using the Safe Entry QR code. We wouldn't want that, but we would actually want the Safe Entry NRIC, which is a bit different from the QR code. So this is something that which the GovTech will actually need to be able to access to risk records. So we also find that this is actually one of the non-compliances found on site. Okay, the next part is that the SMO is actually found not to be on site. Now, for the works which are actually restarted on site, we will expect the SMO to be on site. Granted that probably some of the SMOs may have to look after a few sites, but the requirement is that when work starts on that particular site, the SMO is required to be at that site to actually look after the whole situation. And this is actually one of the requirements. Okay, and lastly, is a part which I mentioned about meals are actually found not individually packed. And there were times that we go to the site and we found that the workers still cook their own food and they actually share amongst themselves. This is actually not allowed for. Okay, next, probably I'll share with you some of the good practices that we actually found on site. Over the pictures, you can see that there are actually segregated entrances. This is actually something that we find in our community as well. Safe distance markings, the clear zoning plan, and temperature monitoring that you can see on site. And this is something that once it's actually being monitored and actually goes back to the HQ for collation of data. And they're actually safe distancing induction. This is actually being done by the SMOs to the workers to explain to the workers why they are doing a series of measures and the importance of that. Last, there's this part on the individually prepared meals where workers are actually eating here separately. Okay, these are some of the not so good examples on site. First, there's actually cooking and on site, which leads to sharing of food. Okay, and this part that the safe entry is not used on site. As I mentioned, we would want the safe entry NRIC and not the QR code. So builders will have to actually make sure the hardware is there. And the next thing is the poor isolation facilities for sick workers. So essentially, it's a place that we would want the builders to be able to separate the workers, and it is a place where the workers can rest, and is a place which good ventilation. So this is important because when something really happens, we want to make sure that everything is properly segregated. So based on what BCA has been inspecting for the past 1.5 months, we actually do take enforcement actions to site, to these builders, which we find that there are non-compliances. So this could be something as simple as a stern warning to safety timeout or even issuing a stop work order. But of course, BCA will actually audit these sites for more than once, and if we find continuous offences, we may actually escalate the enforcement actions to compensation or even prosecution action. But I think essentially it is not so much the enforcement which I want to highlight here, but it is actually more the importance of what we deem as this surveillance maintenance audit. Okay, something which the builders must actually look at to make sure that your site is actually kept safe. As was actually mentioned by a few parties just now, I think it is actually our collective role, whether it's the authorities or whether it is the builders. I think we all should play a part in making sure that everything is kept safe at site to make sure that we can continue to have a safe working environment. So basically, that should be all. Thank you.
All right, thank you, Charmaine and Jeremy. We will now move on to the Q&A session. You may raise your question by clicking the raise hand or the Q&A button on your screen. I think there are a number of questions in the Q&A already. So over to all of you at the panelists.
Good morning, everyone, again. I think, yes, now we are back at the Q&A session, but maybe before we start taking questions from members of the floor, may I also invite the co-chairs from the various TACs to also share a bit that in the last month, what your organizations have been doing, initiatives that you have rolled out to support this restart processes for your members, as well as the platforms and the initiatives that you have. So maybe we will go by alphabetical order. Can we start with ACES? Engineer Chua, please. You're muted. We can't hear you.
Maybe I'll let the other panel start first.
Oh, okay. Maybe next, then Engineer Chan, Eugene.
We basically, IES is reaching out to members, and I have guessed some members here, and welcome to this webinar. And what we know that this is a challenging time for construction, and there are a lot of negative news for the last 2 days. Construction GDP dropped for the last quarter, and also there's some retrenchment in the RWS. I think all this happened lately, which is not good. So here, I think there's a webinar that we try to get members to restart. Hopefully, this clinic will help them, and we'll see them get the work start, and that will move the economy in this construction industry. Yeah.
Thanks, Eugene. Next, maybe SIA, Richard.
Okay. I think first and foremost, you can hear me, right?
Yes.
Okay. First and foremost, we want to thank BCA for putting together this webinar to help the industry to restart. I understand among there are not only consultants among us, there are developers and even contractors for this webinar. Okay. In fact, I think I echo what Engineer Chan says. Actually, maneuvering, we are actually maneuvering in unfamiliar territories, and this is very challenging times for all of us here. And information from various sources or numerous sources can be challenging at this moment and overwhelming. And it's good that BCA is now the main point of contact, and that eases the application for the industry to resume work. And many thanks to BCA in giving this sharing to lessen the pain that the industry is experiencing. And we hope that through BCA sharing, there will be better clarity among practitioners in application to resume work. Now, coming back to SIA, during these difficult times, our institute actually organized many webinars to help members to overcome, or rather to make it less painful for members to maneuver in these unprecedented times. And we hope in the coming months ahead, we will be organizing more as we see more clarity in the way forward. And this webinar is just one of the initiatives that we thought would help the industry to move forward. Thank you.
Thanks, Richard. Can I pass the time over to Colin from SISV, please?
Thank you. So from our perspective, I mean, as the gentleman before mentioned, this is an evolving thing. Every day is new, right? And I think that the first initiative we put forward was the webinar that dealt with the COVID bill, yeah? And I think what came out of that was very clear is liquidated damages, etc. We all put on hold, performance bond, we all put on hold. You can get time we can give, not a problem. I think, but the follow on from a cost management perspective was, can you help share the burden? I think that really was the question that was first and foremost on everybody's minds, yeah, because out of that bill, it was very clear that this bill does not enable you to go and claim for more money, Mr. Contractor, okay? And so, you know, we have been asked by clients, both in the public and private sector, what now, Colin? You know, the contractors are going to come with big claims, what now? And I think we were very happy to see that government is assisting in the process of, with, you know, the ex gratia prolongation cost share, yeah? It has its cap, it has its limits, but at least it's something, yeah? There's also recently, I see now that the COVID safe support that's come out. People were hoping that figure would be higher. I mean, you know, $150,000 and $400 per worker, it's better than nothing, but I think that the feeling is it's not enough. I think, you know, I think the biggest concern, yeah, the biggest concern that we would have is, you know, in the prolongation one, it's the manpower that has been left out, okay? So we've said the manpower is not included. You will get some through the job support scheme, but I think a lot of contractors are saying, particularly the foreign contractors, the Japanese and Korean ones, are saying, well, all my supervision staff are Japanese and Korean. These people are not, you know, I cannot get money for them. Can you please help? So I think that is an issue. What we're also seeing is the private sector saying, this is what government sector is doing, what must we do now? You know, so we're getting those types of questions from clients. My advice really that we would give everybody is, hey, look, this is nobody's fault, yeah, and you know, where we can ex gratia, we should do something, you know, and that applies to consultants as well. So that's where we are at the moment.
Thanks a lot, Colin. And Engineer Chua, back to you.
Okay, thanks, Chairman. I'm glad that we have these seminars because everyone is actually preparing to start work, hopefully. And of course, there's a lot of questions being asked because many issues involved, something is new, and this clarification certainly help. And of course, one of our speakers has mentioned for consultants, I think there is a help which has been will be welcomed by the consultant, which is the enhanced JSS. So many of them may not be aware. So you can actually, it doesn't come in as a default, but you need to apply. So if you, let's say that there is a need, then you can do apply for enhanced JSS. Of course, for the ACES point of view, the members, I think the current concern, of course, is the work progress, because our work are related to work progress. And hopefully when you restart, then the engine will keep going. Other than that, for consultants, the issue will be on the swab test, right? So some of them are ready, and some of them have already gone through 2-3 rounds. I believe Eugene also has gone through, right, ready to start work. So most of them, you can see, based on the facial, is positive news, and not positive result, positive news, yeah. And of course, the issue will be whether whether all the members need to be tested, because the last time we ever discussed is that site supervision, maybe we can use digital. So there's the articulation that maybe some of this work can be rely on through the message by the site staff, through videos or through computers, and that's why I minimize the needs to visit the site. So this thing, I think, is still being worked out, and hopefully we can come to a good way of moving forward and ensure the safe work at the site. Yeah, that's all from me at the moment. Yeah.
Thank you, Engineer Chua. I think from everybody's feedback or discussion, really everybody's projects or everybody's work is affected by construction restarting on site. And as we know, more dorms will be cleared from now to the end of July, and a lot more will be cleared by middle of August. So really a lot of projects can restart when the workers are released from these dormitories. And so all of us as a community need to work together to ensure that safe management measures are on site and ready, so that our projects are, the risk of the projects getting COVID will be minimized. So I think this is an important point to have the webinar, so that we can go through this process as quickly and as safely as possible. With that, maybe it's a segue to also go into some of the questions. Perhaps we can start with questions on sites first, per se. I think there are some questions that talks about zoning and segregation of different teams on site. I think there's also a question about only 2 specialist contractors can work on the site at one point of time, or where workers are already cohorted and staying in a common city queue, can all of them work in the same zones on site? Perhaps Vivian or Jeremy can share some inputs on the worksite requirements.
Okay, yeah, thanks for me. I'll take the questions. Okay, so for the, I think I've also replied to some of the questions, like just now one of the questions mentioned for specialist contractor, we are keeping to a maximum of 2. So it's actually written in the section that it's considered under short-term works. So if specialist contractor need to go down to site, because specialist contractor travel to multiple sites. So we take them as higher risk workers, which is why there is the limitation. So in the guidelines, you can see that if such works need to be carried out on site, we would encourage the builder to keep these specialist contractor away from the main workers to minimize or even to totally avoid interaction. So that's one of the aspect. Another thing is that we also ask for a safe distancing officer by the builder to supervise, to ensure that these two groups of workers do not mix. Similarly, it's because they are considered high risk, having said that they travel to multiple sites. So they might, if one of them is infected, they might actually easily infect multiple sites at the same time. Then I think another question that was mentioned was on the cohorting one. So this issue will not arise if they are cohorted together. So if you know that you have some specialist contractors who are, let's say that, for example, waterproofing specialists or like piling contractors, if they are to be working on site for a short period of time, maybe for a few months, maybe for piling like a month or two, and if you feel that since they are working for a month or two, you can cohort them together, then such requirements will not apply because they are, in other words, staying with the main workers. So you just need to make sure that for different activities, you keep them segregated between different zones. So that will surface. I think there was one more question. I can't remember what was the third question. Sorry, Su-Ming, what was the third question?
I think generally the sense of, how to ensure that there's safe zoning and safe teaming on site.
Yeah. So yeah, we try to keep workers who are working on different activities in their own zones and to segregate them. So between different zones, they are to be kept at least 2 meters away from each other. Actually, the main thing is to, in a way, to keep them in their little bubble as far as possible. So that's the main intention. And to prevent resurgence of like clusters from forming. So if there is one being infected, then hopefully it's only kept within that team itself. Yeah.
Okay, thank you. But maybe just to stay on site a bit more, and this has got to do with consultants. I think there's some questions also on when there are inspections to be done, whether it's a TOP or say RI inspection and things like that. How do you segregate the people who are going for the inspections or the people who need to be there for inspection from the general workers from the work site? Is there a need to segregate?
Oh, okay. In terms of like, I think I've also answered a few questions asking for TOP, if the project has obtained or hasn't obtained TOP, do they need to submit under construction project? So maybe I go on that first. So just to clarify, right, for projects that have not obtained TOP, you still need to submit under construction project. But once the project has obtained TOP, then it can be submitted under construction account works. So we have an item down there that's called defects liability period. So if the workers need to go in to do like defects rectification, they can actually apply under construction account works. So they do not need to come in under construction project. So that's one thing. Then for the second thing that, let's say if the QP or the RI inspectors, etc., goes down for inspections, what we encourage them to do is, as far as possible, if you can do virtual site inspections, do so. If that cannot be done, then when the consultants are going down or the QP are going down to do the TOP inspections, then for workers to be kept away from the rest of the inspectors as far as possible. So we try to encourage them to work in isolation. Yeah.
All right, thank you. Next, perhaps we'll go into questions on swabbing, because I think there are quite a number of queries on swabbing. Firstly, I think there is mentioned that consultants go to multiple sites. So how do they make arrangement for swabbing? If their details are included in the project team submissions, then will there be multiple applications for these same consultants because they support many projects? Secondly, I think there's also a question that says that the consultant only goes to site every 3 months. Given that they only go to site for 3 months, so they need to be swabbed every 2 weeks. I think these are questions that are asked. And lastly, I think some of them have not been asked or have not been scheduled to go for swab tests, although the workers on the same site have been asked to. So what do they do? Can they continue to go to site? So can we have Ted to answer some of these questions?
Hi.
Hi.
It's
Cameron.
Yep. Hi, Suming. Hi, everyone. So, for swabbing, I will take the questions. Okay. So, the first question was about consultants with multiple projects. So, if you have multiple projects, you are supposed to be included in the application to restart under the main contractor. And once that application is approved, there will be a link for your employees to fill up your details, and BCA will use those details to arrange for your swabbing. So if you have multiple applications that are being approved for the same employer, for the same employee, we will just arrange swabbing once, and you do not have to submit that Form SG multiple times. Yeah. So that is the first response. And then the next question, Suming, what was the second question you asked?
Someone who goes to site only every 3 months, do they still need to be swabbed every 2 weekly?
Okay, so when we arrange for the swabbing, we do not know whether the consultant will be going to site every day or every 2 weeks or every 3 months. So we will actually just schedule the consultant for regular swabbing every 2 weeks. But if you feel that there is no need to be swabbed every 2 weeks, you can opt out by informing us at BCA swab appointment, and then we will stop swabbing you until you need to go back to site again 3 months later.
Yeah.
Yep. And the last question was,
I think generally there were mainly two. Oh yeah, the last one is that the locals or the Singaporeans and workers were arranged to be swapped differently, I think, in terms of schedule. So some receive
okay.
their schedule, some not, I think.
Okay, so if you noted that any of your workers or your employees have not been scheduled, then no issue. You can just write into the same email where you received the appointments from, and then we'll pick it up from there and make the necessary arrangements.
Okay, I think there was also a comment that sometimes they receive a schedule for swabbing on a very short notice. Generally, how long are they informed ahead?
Usually we try to inform the firms at least 2 days in advance. Yeah, but once that has been, the first swab has been arranged, usually the firms should just take note that we will make the same arrangement every 14 days. So if you are tested on a Monday, then expect the next test to be 2 weeks later on a Monday as well. So hopefully firms will just take note of the swabbing pattern, and then yeah.
Okay, thank you. Thanks,
Right.
Cameron.
No worries.
Anyone else has anything to add on swabbing? Anyone from the TAC panel?
Can I ask a question on the swabbing?
Sure, sure.
Can the BCA or MOH look at, is there a need for consultant to do so regular swabbing, so routine 2 weeks intervals? I feel that perhaps we should study that. Is there a high risk that, is that risky that we need to be doing so routine 2 weeks interval and save some cost for the government? If there's a low risk, I mean, for local like Singaporeans, those local that not really every day go to site, occasionally to go to site, but do we need to do so regular? That's where my question is.
Okay, thanks, Eugene. I think we'll take your feedback. But generally, construction sites are seen as high-risk locations. And I think because consultants go to site to mix with their parties in construction sites, therefore really is to safeguard your family and your friends and the larger communities. We want to ensure that you are safe as well. And therefore, the swabbing has been arranged. So really, the swabbing is there to safeguard the rest who are around you as well. But we will take your feedback,
Yeah.
and of course, this will be studied closely as
Maybe by statistic can see then if can reduce the
Sure.
frequency in the sense. Yeah. Thanks. Yeah.
I think just now, sorry, Chua here. Chairman, I think just now the Cameron has mentioned there's option to opt out. I think because currently, I know of 1 or 2 cases where, you know, the consultant, the QP themselves preparing themselves, they do a first swab test, and then it's just followed by another. Is the next they're going to do another second one already before even the work started. You know, so it's something at the moment you start, every 2 weeks you'll start again. So I think Cameron probably have answered that question, that it's possible that you opt out when you find there's a possibility that it may not be necessary, and then you can continue to schedule it such that, okay, next week I have no choice but I'll go, then maybe I'll follow up. Maybe that may be a more flexible arrangement. Hopefully this can be worked out now, instead of just routinely do the swab test. That's what you did.
Yes. So I think what Cameron's team does is that once you've started to swab, they will arrange you every 14 days. But if you no longer go to site, then yeah, by all means opt out, because then you are not exposing yourself to the risk of mixing with site personnel.
So in this case, the question of us about 3 months things, for example, just like I mentioned, is, let's say for example you have to go to site 3 months. So in between, I think it's only logical that, you know, you don't go to that regular the 4th quarterly swab test. I find it will definitely not be necessary. Yeah.
Yes.
Chairman, can I ask a few questions about the authority inspections? I'm not sure is so-called has some kind of a protocol has been set up pertaining to all the various inspection that will be forthcoming. For example, things like maybe shelter inspections. Shelter inspection, we have RI inspections, we got BCA inspections. I think there need to be some understanding how we can arrange this. For example, let's say we start off with shelter inspections, and I personally go down to all the shelters inspection myself. So we have very big group of people, because there are people who do the pressure test and check all the concealment, whether it's done or not, on top of the officer from BCA and SCDF. So there's something I would think to the number of maybe 15 people for the storage shelters inspection alone. And there are subcontractors, consultants, authority rep, you know. So there's many groups of people coming together. So I'm not sure how can we segregate them.
Okay, so maybe Vivian or Jeremy, would you like to take this question? I mean, generally, I think the necessary inspections will still need to proceed as projects carry on. And I think the first principle would be to only have the parties that really needs to be there lah. So those people that needs to be there, no choice, they have to be there. So then how do we minimize risk from this group of people? Perhaps I don't know, Vivian or Jeremy?
Okay, yeah, I'll take the question.
Thank you.
Just to reply, yeah, Architect Richard. Just now when you mentioned the different parties, right? Actually, it's okay to have different project parties going down together as long as they are kept away from the workers who are staying in the dormitory. So you can have like consultants, you can have like some inspectors, you can have SCDF officers, BCA officers. Actually, generally those are okay. What our concern is more of like this group of people should try, when you go down for inspection, should try to keep away from the main workers who are staying in dormitory.
Okay, maybe I should explain further. These workers, there'll still be worker among the people who go down for inspection. These workers are actually the contractors' workers who put up the shelter. They will be doing some pressure testing. And then probably, let's say the officer asked to check whether the seal of the cabling are done properly. The contractors will have to get their people to go and test it out to show the inspector that it's done properly. So there will be this crossing of path. So I don't think it will be possible that maybe the consultant or even the the inspector will have to carry out those tasks themselves without the workers.
I guess for such instances, if it cannot be done virtually, then the other option would just be that you just have to minimize the contact time. Because if it's not possible to minimize physical interaction totally, then it's the time spent down there. So as far as possible, once you go down, you inspect, you see the test, then what we encourage is that if there's some follow-up action, maybe the follow-up action can be done virtually. So if there's just some small non-compliance, instead of having the whole group going down again, maybe the second time round, you can, it can just be done remotely, like a virtual, you can do it through WhatsApp video call, etc.
Okay.
Yeah.
And I got other questions for example, other authorities. Is this already a standing order for all the agencies? For example, if let's say there are inspection by BCA for TOP, can we do it remotely or we have to be physically on site? And also, is there a common understanding also for RI inspections? Because if let's say we all agree, okay, RI will not go down. We have the worker to bring a camera and walk around the site. The RI can direct the worker where to walk. All right. So the RI probably and maybe a few of us will be probably find a table and chairs outside the site, waiting for looking at the camera when he walks. You know, is this an understanding that even the other agency can accept the responsibility being executed? Because the thing is, for SCDF, they will expect the RI to inspect everything. But now the RI is inspecting off-site. Would there be any problem that SCDF may raise to say, hey, hello, Mr. RI, you should be walking? You know, so there may be different expectation from different agencies.
So
what do we do about that?
Yeah, in terms of if you're talking about like SCDF one, that one we will take the feedback and we probably will need to check with them because what we can only say is for BCA, we can accept that because that one we have checked with the Commissioner of Building Control. So, and he's comfortable doing that for BCA's inspection. But in terms of other agency, I think that one we have to take the feedback, then we have to ask to consult with them. Whether are they okay to accept them as well? Yeah.
Because it's easier for practitioner if there is already a common understanding. We hope that we are not crossing any rules, any boundary lines that will probably bring questions or even interview the architects or engineers, because they didn't actually go down to site and walk the site with the respective authorities, leading to the final clearance of the EOT. I mean, the TOP. So I'm not sure in this case, will the TOP be delayed because agency did not have a common understanding?
Yeah, so this one we'll probably have to take the feedback and then check it offline. But actually, just to fill you in a bit, even before this COVID-19 started, there were some pilots. We are trying out some virtual TOP, but it was that time we just started only. So I don't think there was much.
I mean, I'll be glad to offer my presence on this discussion to detail further, because personally I'm very involved in all the TOP process myself. Okay, so I can feedback to you basically what is possible and what is quite impractical.
Yeah.
I mean, one more question is even this. Okay, I got job site going for TOP and they only have probably another floor slab on the road to cast. But you see, in terms of BCA would want engineers or even, like let's say it's a major casting. They need the engineers to be present, standing supervision. Now we don't have. Would that be a problem? But of course, recording are being made. We have the video inspection recorded.
Okay, for those inspections, we can accept, when we say remote site inspection, right, we are saying that the RERTO is still supervising, but he's just doing it, like he can be in a site office, but he's still looking at it. So it's not so much like the builder records the video. It's more of like the RERTO can still direct using a video call saying that, okay, can you tilt the camera to the left or to the right? Actually, we are starting out some projects, some pilot projects on that already. So to see how it can be done. So
it will be good. Okay, so that means it will be good to share in a different webinar how different agencies' inspection can be carried out. for the safety of every individual in the construction industries. So that will be some common understanding how things can be done, because I have personally got few projects going for TOP. I have clients asking me many questions, but I don't have a definitive answer. But I think certain things can be done, but I hope the relevant agency can coordinate and have some standard so-called operation procedures for all to follow, and then there's clarity among practitioners what to follow and what is yes, what is a no.
Richard, I think it's a very good comment, and I think for today's clinic, we are really focusing on restarting process, because we really want many projects to be able to start first. Not enough has restarted. And I think in the next month's seminar, we are actually looking at best practices, sharing the good and the not so good. So best practices would include things like inspections, site supervision, what are the technologies that can be adopted for remote monitoring. All these would be things that we will share at the upcoming clinic that would really cover on-site processes, recovering and proceeding safely. I think these are some of the things that would be upcoming. So today, I think we will try to focus on restarting first and getting projects going. Maybe can I go to the one more topic before we move to the hands, because it's already 1:08. There's quite a number of questions about accommodation and transport. I think some clarity on whether S-Pass holders need to be staying together with the workers on site, whether different S-Pass holders who are supporting different projects can stay in one apartment but in different rooms, or whether the S-Pass holders who are RE and RTOs can take public transport to work. I think these are some of the questions that are from the list. Ted, you're ready?
Yeah, okay, thanks Chairman for the questions. Actually for the questions on whether the S-Pass holders and the work permit holders have to be cohorted together, I think previously we did release some updated requirements stating that actually for the S-Pass holders now, we do not require them to be cohorted with the main project force. But minimally, this group of S-Pass holders, they should still ensure that they are not staying with other workers that are working on any other projects. So in this case, if your S-Pass holders are staying with other S-Pass working on a different project, same HDB unit or same PRP unit, but they're staying in a different room in the same unit, this is not ideal for us as well. So we would still require them to find a solution to maybe move out or find an alternative accommodation to house these S-Pass holders. Then for the question on the transportation, I think as Vivian mentioned just now as well, these workers going to site, they are generally regarded as a bit higher risk. So we are still not very comfortable letting these workers actually take public transport yet. We are looking into how we can relax these requirements over time as well. And we are taking in a lot of the feedback from the industry. We understand like some of these workers, you know, they have already been swapped, cleared, they come from cleared dorms and all that. So I think in this respect, we are hearing what the industry is saying, and we are trying to find a way to work about this. But we also have to be mindful that we want to manage the risk of possible transmissions and prevent any potential resurgence in the COVID cases. Yeah.
Okay, thanks, Ted. I think at this juncture, let's move to the people who wants to raise questions verbally. So we have a few hands I can see. Can I get the assistance of the MC to help?
Yes. Hi, Mr. Loh Yong Guan. Mr. Loh Yong Guan, could you unmute your mic and ask your question?
Yeah.
Yes, we can hear you.
Yeah. What is it? Your question again?
You have raised your hands. So what is your question?
Okay. Oh, I have no question. Just now I was trying to click the question answer to read other people's question.
Okay, it's all right. Thank you. Then we shall move on to the next person. All right, Mr. Lim Guan Yu. Hi, Mr. Lim. Could you unmute your mic and ask your question?
Hi, good afternoon. Can you all hear me?
Yes, we can hear you.
Yeah, I have two questions. Number one is my client actually they are staff in the hospital. We are doing an A&A project. They are uncomfortable or prefer to have their swab test to be conducted by the hospital itself. Is it possible? Instead of going to BCA or HPV arranged facilities.
The swab test for their workers or for the consultant team?
For their staff, they are the developer team.
Oh, okay.
They are located in the hospital, so the works are inside the wards.
Cameron?
Yep. Hi. For such cases, right? We have the understanding with Health Promotion Board that they should tap on the BCA arranged swabbing test rather than get them tested privately. So I think if you have such a project, please do register with BCA and then we'll make the arrangements for swab test. Yeah.
Thank you. And you had one more question? Colin, I think you need to release him.
Yes, he can actually continue. Yes.
Hello?
Yeah,
So the
we can hear you.
the answer is they must still go to HPV arranged facilities, correct?
Yes, and that will be facilitated by BCA.
Okay, can. Then my second question is can I ask if the builder is obliged to provide simple coffee, Milos or snacks for tea breaks instead of lunch and dinner, because I understand for proper meals builder have to provide prepacked lunch lah. How about for those like 15 minutes, 30 minutes tea breaks for the workers? Are they obliged to provide also?
Jeremy?
Yes, I think it is actually your prerogative to actually provide tea or Milo, whatever. I think the principle that we want to observe is that it must be prepacked. Okay? In this case, I think they shouldn't share it lah. Yeah, so I think that is pretty okay.
Yeah, I think generally the principle is not for workers to share food or to eat common food together, but try to have them eating quite isolated from one another. So generally that's the recommendations. There's no requirement to provide snacks. Okay, can we move to the next person, please? Mr. Ng Hock Soon.
Hi, Mr. Ng. Could you unmute your mic? Mr. Ng? If not, maybe we want to move on to the next person, shall we? Okay,
yes.
I think the next one we have is Mr. Deepak Nagarajan. Hi, Mr. Deepak. Could you unmute your mic? Okay, maybe we then move on to the next person. Mr. Sim Kwai Ming. Hi, Mr. Sim. Could you unmute your mic and ask your question?
Sorry, I think most of the question has been answered already, so I don't have any more further questions.
Okay, great. Thank
Very
you.
good.
Okay, then we move on to Mr. Yoganathan Ganesh. Mr. Yoganathan Ganesh, could you unmute your mic? Yes, thank you. And ask your question.
Good afternoon all. Actually, I am working as RTO. Actually, I am holding e-pass. Actually, I understand that the S-pass holder cannot share the house with another S-pass holder.
Ted, you want to clarify on this again?
Yeah, so I think in this case, if
House
the other, wait, sorry.
Another S-pass holder who is working under construction can share the house with me.
In this case, actually, if you guys are not, if the nature of your job doesn't require you to go onto multiple sites at a time, right? Then we would advise against that. So we would require that you actually be staying separately.
Oh, okay. I understand. Because my owner is want to rent out the house to the S-Pass holder. They came to see house, but since they are working under the construction, my owner couldn't rent out. So and indirectly, my owner want me to vacate the house. That's why.
Oh.
You try to find
Yes.
someone from your same site to stay with you.
Yeah, so alternatively, you can find someone from the same site.
The problem is I'm only one RTO in my site. Also, my company is supplying only one RTO to that site. I have to deal with the main contractor.
Yeah.
All right. Thank you, Mr.
Challenging
Ganesh.
time.
Yeah, thank you.
Okay,
Thank you.
maybe
Thank you.
last two.
Okay, Mr. Ong Koko. Ong Koko, could you unmute your mic and ask your question? All right, I think maybe we move on to Mr. Roger O. Mr. Roger.
Yeah, hi. As we know, MOM is clearing a lot of dormitories at this moment. From the slides, I noticed that you said that once the dormitories are cleared, we can arrange for the workers to come back to work. However, there is a discrepancy with the BCA restart criteria, which states that those workers in the dormitories must still be segregated through floors or through rooms. Is that correct?
Ted?
Yes. Ideally, they should be segregated that way.
So if they are not, because the issue is now the arrangement with the dormitories, most of them is very hard to meet this requirement. Because, like for example, if a small contractor for 40 to 50 workers, how are they to rent a whole floor which can house up to 240 workers?
Yeah, I understand. I think this one is something that we are actually working with the Joint Task Force in trying to reshuffle some of these workers around. So ultimately, there will be some concessions that will be given to some of these projects. So I think as of now, as long as we can, you are able to sufficiently prove that your workers have been segregated, like sufficiently, then we should be able to accept that.
Okay, currently from what I understand is that minimally most contractors are able to segregate by room, but not by level. So minimally, if we meet that criteria, are we able to submit for approval to get these people to start work first?
Yes, you can just submit for approval first after you've met that. Yeah.
Okay, thank you very much.
I think just to add, I think we are working jointly with MOM and the rest in the Joint Task Force to look at even further segregation within the dorms itself. That's the principle we're looking at moving forward. But even if they cannot be cohorted by a whole floor, at least they are separated in the common facilities that they use within that same floor. So no workers from two teams should share common toilets and common eating areas and things like that. So I think those as a start, you can start working with the dorm operators first. That will at least facilitate isolation and segregation of teams, even at the accommodation, before they go to site.
Yes, I fully understand the direction that we are going at, but the issue is because in the BCA restart criteria, it's written as one thing, and outside we are doing something else, and we are declaring that we have already put them under safe accommodation under BCA safe restart criteria. So we do not want to be faulted for that if we do segregate them into rooms.
Okay, maybe just put under the remarks to take a note.
Understand, thank you.
Thank you very much. So I think we will have to close the webinar with...
I'll just jump in here quickly.
Yes, Colin, you have something to add?
No, that's not from me.
It's Colin Kin.
Colin. Oh, okay.
This is a related issue on restart and accommodation and dormitories. And I think a lot of people are going to be asking this question because it's related to money and how much money you can get back, okay? So I think that the prolongation support is split into a number of phases, all right? So the circuit breaker, very clear. The extended circuit breaker, very clear, right? Then the third milestone is restart, okay? And we've said that is the earlier of whatever the period is, or the 6th of September, yeah, but it's maximum only 5 months. And then after that, there's 4 months of loss of productivity time that you can have. The question that's been posed here is, they have gotten the restart, but they are waiting for the authority to approve the TOLQ application. So that the restart has been given, but they can't physically start actual work on site because the dormitory is not ready or haven't been cleared, right? So that's the question from a support measure perspective. When is the cutoff date? Is it the restart date as per the letter, or is it the restart actual on-site date? From a support perspective.
All right. We have colleagues, Simon or Cynthia. Would you be able to take this? Cynthia, are you online?
Hi, I'm online. Sorry, can you repeat the question again? Sorry.
Okay, so Cynthia, this has to do with the ex gratia prolongation support, okay? And we're talking about the cut-off dates, yeah? So the prolongation support is split into a number of phases. The first is circuit breaker, very clear. Everybody knows what that is, yeah? Extended circuit breaker, very clear, right? The third one is up to the restart date, okay? And herein lies the question from some contractors that actually gotten approval to restart, okay? But they don't have the clearance of the dorm for whatever reason, whether it's a TOLQ application or whether they are able to cohort their workers, they can't physically start work on site. So that's the question, is from a support perspective, that period, is it the date they receive the approval to restart, the letter, or is it the actual physical start date on site?
Okay, so sorry, I think this one will require the PPD from Florence. Is Florence around to answer?
Hi, I'm Manhon here from BCA's Procurement Policy Department. So just to answer this question, if you are referring to the circular that we have sent out, the cutoff date is based on the BCA approval for construction restart. So, but we also understand that, like what Colin mentioned, even though after the restart have been given, most of the contractor might not have the full workforce to start work on site. So for this matter, we are actually discussing the GPs. I think the GPs, they do have certain flexibility in deciding where's the cutoff date. So we'll be discussing the GPs, and if we have any further guidelines or to clarify on this matter, we'll issue up some further communication to the industry to clarify on this matter. Yeah, thank you.
Thank you, Manon.
Okay. Thank you, Colin, for your question. I understand there are still many others who have questions to ask, but unfortunately, we have to bring the webinar to an end. Again, all your questions that you have included in the Q&A written form, we will try to answer as many as we can, and these will be published on the webinar link in BCA Academy's website. And I think generally by next week, all the answers will be posted as well. So I think I encourage all of you who have asked questions, or those who have not asked but you face common challenges, to go back in and to look at the posted answers for all the questions that has been put forth. So with that, I think I'll bring the webinar to a close. Can I invite the co-chairs to have any last words that you want to share? Some of the suggested areas that you've asked us to look into, like the inspection regime, the segregation of accommodation in the dorms, given that more dorms are opening up, looking at support package and the time frame for application. These are areas that we will look at it in a bit more detail, and we'll continue to have more conversations with you as we firm up the processes in place. Are there other areas that the co-chairs would like to also bring up?
I think just say a few things because I think it's good that we are all ready to start with all these things straightened up. things to be positive. What I will say at the moment is we have a lot of measures in place, and we also identified, as Vivian and Charmaine has mentioned, all the issue will be clustered around the workers. So because that is the main source of concern. And of course, the other one who enter the site will face this issue. We have all the measures now. The next thing maybe we can address in the next webinar is how to implement this. That means it's the enforcement part. And at the moment, just now, Charmaine did mention, maybe we should work out certain way of going after those non-compliant, like not wearing masks on the workers, and then give some guidelines so that this thing can be properly enforced at the site. You know, the risk has been identified, and we just want to make sure that this risk can be covered, and then everybody be safe, working happily. Yeah.
Okay. So I think as we also do more A&I inspections, Jeremy's team, good practices and not so good practices will also share so that it will not be repeated.
Yeah.
I think these are things that we'll try to share as much as possible. Eugene, you have something to add?
I hope you have good takeaway in this clinic, and hope that all can restart as soon as possible. Thanks.
Thank you. Yes, Richard.
I think I'd like to thank BCA for the hosting this seminar. I'm sure the members here actually would have picked up a lot of key points over this webinar. And but moving on, we want to appeal to BCA to further streamline where possible, to make the restarting process more accessible and more straightforward, to help the industry to restart. Okay, I think that's all.
Thank you. Colin, anything else to add?
All right, that's all. So we have come to the end of the webinar clinic. Once again, I would just like to reassure everyone that we will collate all the questions posted, and an FAQ will be uploaded on the BCA's website at a later date. So with that, I would like to thank the webinar chairpersons and also the speakers for their valuable insights about the good practices on project restart application. It has been really a fruitful and engaging session. Also, we are also pleased that BCA is now on Telegram, and I noticed that through the poll just now, many of you were still not on Telegram, and you may wish to subscribe to it to find out about the latest updates and information on the BE sector. So on this note, we have come to the end of this session. You will be able to download the speaker's presentation materials on BCA's website. On behalf of BCA, SIA, ACES, IES, and SISV, we'd like to thank you for your participation and making this clinic a success. We wish you a safe and smooth restart. Signing off, this is Colin Chu from BCA.
Thank you very much.
Thank you.
Thank you.
Thank you.